Hello, this is Dr. Aanchal and today I'm going to tell you about dandruff, its causes and how to treat it. I make videos on skin care and on hair transplantation. If such content is of interest to you, then please subscribe to the channel. So what is dandruff? Dandruff is white scaling seen in the scalp, usually in winter months. So see, a mild dandruff, mild flaking of the scalp is normal. So dandruff can have a wide range. It can be just mild flaking which occurs in the winters, which is considered normal, or else severe dandruff can occur throughout the year and produce very thick scales, and it can also be accompanied by irritation and redness and itching. So we all must have suffered from dandruff at some point of time. So dandruff is just thin white scaling of the scalp. In medical terms, we refer to it as seborrheic dermatitis. There's a certain school of thought which calls dandruff a non-inflammatory seborrheic dermatitis, meaning thereby that there is no inflammation. That means there is only white flaking but no redness or irritation associated with inflammation. Even clinically it varies. It might be just thin white scales, or it can be very thick, greasy, adherent scales. So why does dandruff occur? The exact cause is not known, but there is an increased production of oil in the scalp. And also the quality of this oil, the quality of the sebum is different than that seen in normal scalp. Along with this, there is proliferation of a fungus called Malcizia, which worsens the dandruff. And there is also known to be certain genetic predisposition. So there are certain change in your genes which predisposes you to develop dandruff. So a lot of people feel that dandruff is due to poor hygiene. Absolutely not. You just have a propensity to develop dandruff. But dandruff does aggravate if you do not wash your scalp regularly. So regular shampooing of hair is very important if you're suffering from dandruff. And also people who use a lot of hair products get a little bit of flaking in the scalp which appears as dandruff. Small white flakes which are a result of applying a lot of these products or hair care products or setting products that can give the appearance of dandruff. So you have to make sure that it is dandruff that you're suffering from. There are a few conditions which can be confused with dandruff, such as scalp psoriasis can also appear as dandruff. Along with that, maybe even certain fungal infections like tinea capitis can appear as dandruff, and even contact dermatitis. If you're allergic to certain components that you're using in your hair care products, that can also present with itching and redness and certain flaking, which can be confused with dandruff. So you must visit a dermatologist and get yourself diagnosed whether you have a seborrheic dermatitis and dandruff or it is something else. People who suffer from dandruff and seborrheic dermatitis have involvement of the scalp, but along with that you might notice a little bit of redness and flaking even on your eyebrows or on your eyelashes, on the side of the nose and on the chest and back. These are also areas that are affected. So if you have a little bit of scaling and redness in this area, this could also be due to seborrheic dermatitis. So does dandruff affect acne? Yes, so see, both of them are related in the way that both are due to excess sebum production, right? So people who have a lot of dandruff also complain of suffering from acne. So we always tell patients who suffer from dandruff to not oil their scalp. Certain people feel that because their scalp is flaking, if they apply a lot of oil, that will kind of soothe their scalp or reduce the flaking. No, your scalp is already producing a lot of oil. You do not want to put more oil. So make sure that you're washing your scalp regularly and keeping it clean. That is what we want. We don't want to oil and add on more oil on the scalp. So who all are affected by dandruff? It can occur at any age, but usually it is seen during puberty, similar occurrence as with acne, when there is a change in hormones and you're producing a lot of oil, a lot of sebum. That is when you see dandruff the most. So how do we treat dandruff? So we get a lot of patients who come and tell us that, just cure my dandruff. I want to cure for dandruff. Is it possible? No. So we don't like to use the word cure when it comes to dandruff and seborrheic dermatitis, because there is a genetic predisposition. Your skin is made in a certain way that it is producing a lot of oil, and that cannot be changed. But we can definitely treat it, we can definitely control it to such an extent that it doesn't bother you anymore. So let's not use this word cure for dandruff, but there is definitely very effective treatment which can completely take care of your problem so that it doesn't bother or affect you too much. So first and foremost, using a shampoo. A ketoconazole shampoo is a good way to start for treating your dandruff. So how do we use this ketoconazole shampoo or any medicated shampoo? First, you have to properly wet your scalp. Okay, make sure that the hair is damp and the scalp is properly wet. Then you apply the shampoo on your scalp, lather it, leave it on for about 2 to 4 minutes, let it act, and then you can wash it off. You can follow it up with your regular shampoo and conditioner. So see, these shampoos will not lather too much. So you will not feel that your hair has become very clean, right? So this will only remain on the scalp. So you can follow this up with a regular shampoo and conditioner. So how does ketoconazole act? It is a broad spectrum antifungal. So it will tackle the Malvasia infection and also reduce the inflammation that is the cause for the dandruff. Also, you can use shampoo containing ciclopirox olemine, which is an antimicrobial and helps with dandruff. Along with this, even zinc pyrithione will help with dandruff. It kind of stabilizes the scalp, reduces the cell turnover, hence reducing the flaking that occurs in dandruff. And you can also use agents such as selenium sulfide or coal tar. So coal tar also helps in stabilizing the skin so that the flaking is reduced and the cell turnover is reduced. So it reduces the inflammation and hence the flaking thereof. So the key to controlling dandruff is shampooing regularly, using an anti-dandruff shampoo at least once or twice a week, properly, let it act properly, leave it on after you lather it for about 2 to 4 minutes, let it act and then only wash it off. And also if there is severe dandruff, then we can give a course of oral antifungals. So the treatment of dandruff depends upon severity. If it is very severe, we give a course of oral antifungals along with topical, maybe coal tar and an anti-dandruff shampoo. If it is moderate to mild, then we give just lotions to apply, maybe a coal tar lotion at night and then an anti-dandruff shampoo. So you must remember that there is no one-stop solution to dandruff. It's not like you use it just once and it'll go away completely. So we usually titrate the treatment of dandruff according to your response to it. We can start off with lotions and shampoo and then maintain you on just shampoo maybe once or twice a week and then reduce it to maybe once in every 15 days. So you have to be regular with the dandruff treatment. If you found this video useful, please like it, and in the comment section you can tell us what topics you want me to make videos on. Thank you for watching.